Welcome to Learn and Go with Lori. Today we're going to start a mini-series on optimum laser outcomes. One of the most common questions I have is, hey Lori, how do I treat this with my laser? Or, Lori, I'm not getting the best results with my laser. What am I doing wrong? Well, I want to teach you all of my application tips and methods and anatomy and all the cool things to help you get better results with your laser, no matter which laser you have. I want to answer all your questions, not only the ones you have right now, but the ones you would have had if you didn't have this information. I want you to have the best results and be more efficient so you can treat more patients, because that's what it's all about, right? Making more patients better sooner. What we're going to do is start with the carpus. The first step to treating osteoarthritis of the carpus is understanding our goals. If you've ever worked with me and asked me, Lori, how do I treat this? The first thing I'd ask you is, what's your goal? If you know what your goal is, it's a lot easier to figure out how to get there. So let's talk about what our goals are. The first one is to treat the joint capsule. Lots of reasons. The first, the cells that make the inflammatory mediators that cause all the problem in the joint lie on the inside. We want to treat those, decrease COX-2, interleukins, all of that. Plus, if we have edema in the joint capsule, it's thickened. If we go to get up and we feel stiffness, part of that is thickness of the joint capsule. Lastly, is our cartilage is avascular. So the way it gets nutrition in the chondrocytes is to have blood supply coming through the joint capsule, putting nutrition into the synovial fluid, going to the chondrocytes. So if we have a thick joint capsule, we have less diffusion into the synovial fluid. So we definitely need to treat him. We also want to support the chondrocytes themselves. Our cartilage is 20% cells and 80% matrix. So we want to stimulate those chondrocytes to be able to produce more matrix. Lastly, we want to increase strength in the muscles, tendons, and ligaments around the joint to increase stability. We know lasering the muscle allows us to build strength faster. Why do we care about stability? Because if we don't have stability, or we have instability, we're going to have more grind. So by stabilizing, by strengthening everything, we can stabilize everything and slow down that osteoarthritis process. At least that's our goal. Now that we have our goals, let's talk about how to treat our structures. We'll start with the joint capsule. Think about this. The joint capsule is convex, and the cells that we want to treat are on the inside lining. They're the ones that produce the inflammatory mediators, the COX-2, the interleukins, all of that stuff. If we add load to a joint, we're actually going to increase compression and make it more convex. Our energy coming in is not going to be able to treat it as efficiently as if it was flat. So how do we treat it? Traction. If we traction the joint, then all the energy coming in is being able to get to those cells. So it takes less energy. If we have it convex, think about if you are weight bearing, you're either going to take a lot more energy to treat those cells, or you're going to have less of an effect. The next thing we want to look at is the chondrocytes. Right? We want to treat them as well. If we're in load, can't really get to them, so we want to have either flexion, extension, varus, valgus, whatever direction we're having our beam come in, we want to open up those joint capsules, that joint, and then aim our beam so that we can treat the chondrocytes. We also want to treat the tendons and ligaments around it, so we need to know where those are. So let's talk about, or take a look at, some pictures, some bones, and a dog, so we have better clarification so you know where you're lasering. Here's some great pictures drawn by Chris Pasquini. He's got an awesome anatomy book. I want to show you first my most proximal line, just distal to my radius, and then it comes down. My next joint capsule line comes under the radiocarpal bone, and again, now I'm under the ulnocarpal bone. My third one is fun. It's like a smiley face. Whoop. I like this picture because it shows you the lateral aspect of the carpus, and it shows you the joint capsule for the accessory carpal bone. We definitely want to treat that. When we go to the muscles, now this is a cranial aspect, I want you to note that the extensor muscles start all the way up at the lateral epicondyle of the humerus, and we want to follow them all the way down, this guy too, coming down, muscle, tendon, here's my carpus, I'm going to get my joint capsule, and then if there's thickening, I'm going to go below and get the extensor tendons. On the caudal aspect, really important, I want you to know way up here, some of our flexors start on the olecranon. So we want to make sure we get all of the muscle coming down I have my pad that I'm going to flip up so I can get my joint capsule under here, and then definitely follow the tendons all the way down until we get to the metacarpal pad. Why? Because we want to strengthen everything so that they're not in hyperextension, putting more stress on that joint. All right, are you ready to talk about bones? In just a second, I'm going to have you shut off the screen and go feel a dog. But first, I want you to feel something on you. If you flex your wrist, you can actually feel the edge of your radius, joint capsule, and then your first carpal bone. When you do that on a dog and you flex their carpus, you can feel the edges of all the bones. If you can't, and there's a fluctuant feel, that's a fusion. If you can't, and it's a thick leathery feel, that's synovitis, both of which can be treated with laser. All right, let's look at some bones. Here's my radius, and my ulna, and my carpus. When I flex the carpus, you can see how I open up that joint space. That's where I have most of my motion and most of my space, but I definitely want to treat all of my lines. I want you to notice that that joint line that I'm going to treat on doesn't just come straight across. It comes across the radial carpal bone, but then drops down to the ulnar carpal bone. The same thing happens as I go between the radial carpal bone and the numbered carpal bones. I'm going to come across and then it drops down, because you can see the ulnar carpal bone is almost like a two-story bone. The bottom line is like a smiley face coming between the numbered carpal bones and the metacarpal bones. Remember, since I can get into those, I want to. If I go to the lateral aspect, I want to have varus, and I want to treat my joint line. When I go to the medial aspect, I want to have valgus and treat my joint line. When I come to the caudal surface, what I want you to see is there's lots of joint capsule that I can get to, except that there's a pad right there. So I have to flip that pad up and kind of aim inward to get to that joint capsule. I'm going to lose some efficiency, or I'm going to lose some photons, because now I'm treating up at an angle rather than straight in. Really, really important, I want you to look at the accessory carpal bone. I want to go around him, both on the lateral aspect, and come and treat at an angle to get to the medial aspect. That's really, really important. I've actually had patients where I broke up the scar tissue, lasered, got it moving really well, and had 30 degrees more flexion just from working on that. That's really important. Okay, are you ready? Let's stop the tape, go feel a dog. I want you to feel all of those joint surfaces and then come back to me. Welcome back. Today I'm going to teach you how to treat osteoarthritis of the carpus in the dog with the Respond Luminix Vet laser. Our settings are going to be 1 watt, continuous wave, and we're going to use the 808 nanometer probe. It has a lens that's 1 centimeter squared. So that, and the fact that the Respond systems gives us 1 beep per joule delivered, tells us all we have to do is figure out our surface area times how many joules per centimeter squared we want to give, and then listen for that many beeps before we know we're done. Now, if this isn't your laser, that's okay. Give me a minute and I'll show you how to treat with your laser also. And know that each session that I teach is going to be teaching with a different laser. Let's start by setting up the machine. To start the Luminix Vet, I'm going to start by hitting the Start Enter button. It takes just a second, and then my little blue light comes on telling me it's coming on. It's going to ask for my unlock code, which is always going to be up, left, up, right. The next thing it tells me is what my last settings were. It's going to say 1 watt, continuous wave with 1 joule per 1 second. Now, you can see start treatment is highlighted. So if I hit my start button, that's what's going to happen. But I can also change my variables at any time. I can come back down. Respond has it set so that it is going to beep for every joule it's given. It makes it easy. I can always count the number of beeps for how many joules I want. My safety screen, I'm going to pick up my probe, tells me that I have 7 seconds to pick up my probe. Now, as you watch, the little light goes on telling me that it's on, and it's giving me 1 joule per second. Now, if I want to pause this, I can just hit my Start Enter button, and it's paused. I can change my variables, I can move my patient, do whatever I need to. Then I can just hit Start Enter again. If I want to stop, all I have to do is hit the little red button that says Laser Stop, and it goes away. Okay, now I don't have Ollie. What happens if I have a dark skin or dark coated dog? Well, I can treat them with the Luminex as well. I'm going to change my settings a little bit. So I'm going to use my up arrow to get to my power, hit enter, and drop it, use my down arrow to drop it to 500 milliwatts, hit enter, and then use my down arrow to come back to start treatment. That's easy. I do want you to notice that now to get 1 joule, it's 2 seconds. Still going to be 1 beep per joule. The other difference is when I treat the wrist, I'm going to treat one area at a time, and I'm going to take my time. So I'm going to get my 2 seconds, 1 joule, 2 seconds, 1 joule, 2 seconds, 1 joule, and then come back and repeat that until I have the number of joules per centimeter squared that I want. My plan for treating an 85-pound dog with carpal osteoarthritis would be to treat with 8 joules per centimeter squared for the first 3 to 5 days, daily if able, and then switch to 2 to 3 times a week for 2 to 3 weeks at 10 to 12 joules per centimeter squared. By that time, the dog should be feeling much better, and we can spread it out accordingly. A lot of my patients I can get to once a month. When I look at treating him, the first thing I always start with the cranial surface is I'm going to start with the cranial surface, identify my joint lines, and I'm going to treat along my joint line. I have a 1 center diameter lens, so I'm going to come in here and treat for my 8 seconds. And during that 8 seconds, I'm going to be perpendicular to the joint capsule, and then I'm also going to rock either direction to get my chondrocytes. Then I'm going to move it over. Once I get through that, once I get through my cranial surface, I'm going to go to my lateral surface. When I do my lateral surface, I'm going to have it in some flexion and varus, so I could treat here. You can see that. Then I'm going to do my medial surface in valgus. When I do my caudal surface, let's see if I can pick up this foot. There we go. I'm going to flip my pad up and treat at a slight angle so that I can get my joint capsule. Then I'm going to identify the accessory carpal bone, making sure that I treat both the lateral and the medial aspect of him. Then I'm going to go on to my tendons and ligaments, or my tendons and muscles, I should say. I'm going to be perpendicular to them. Now, if you don't have a Luminex Vet, that's okay. If you happen to have a high-power Class 4 laser with the wavelengths 980 and 810, the recommended dose would be 15 joules per centimeter squared to get into that deep tissue. I would set my machine at 8 watts, and for a dog his size, that's actually about 6,500 joules total. My method would be to use the large contact head, and I would treat the whole circumference of the limb at a speed of 1 to 3 inches or 3 to 8 centimeters per second. Range of motion can be done during the last part of your laser therapy or immediately after, as long as it's comfortable for the patient. Doing that, and traction, where you just stretch it and hold it for 3 to 5 seconds, stretches the joint capsule, which increases proprioception and helps decrease pain. Besides getting rid of the pain, we now need to strengthen all the structures that support that carpus so we have more stability, less instability, less pain. How do we do that? The best exercises to strengthen those structures: digging, the swimming, now that's better than just underwater treadmill, and ball exercises. Why do I like ball exercises? If I have the front feet on the ball and the back feet on the ground and have the dog walking it forward, backward, or even just holding it, I'm working on all of those muscles. You can palpate when the dog's doing it, you can feel it. And yet, their weight is shifted back. So I'm not getting any hyperextension, strengthening without increased compression. Thanks for joining me for Learn and Go with Lori in our mini-series, Optimum Laser Outcomes. I hope you learned something and had fun. I'm Lori McCauley, Optimum Pet Vitality. Take care.